So basically, let's see, today is the 15th. So I guess like 2 weeks ago, I got like really bad chest pains just like out of nowhere. And so I ended up going to the ER because it never eased up or anything. And it was like sharp stabbing pain every time that I started breathing or moved or anything. So got to the ER and they basically did like the whole workup thing, x-rays and whatnot, and I came to the conclusion that I basically had pleurisy. And so nobody told me like where that came from or what they thought that could have come from. So they were just like, well, that's what it is, I guess, because they ruled out everything else that it could have been. But so now here we are, I guess a week later, and I can breathe like a little bit better, but I still can't, yawn without it hurting, or take deep breaths without it hurting. And now I kind of have like a fever, and I'm just like super tired, like really exhausted, and my whole like left side of my body hurts. So I don't know what the dealio is with that, but so they gave me some prednisone. They gave me 50 milligram prednisone, and they had me take it for 5 days. And I guess it worked. I don't know. I still feel it. Obviously not as bad, but it's still there. But basically, while I was at the hospital, they didn't really do anything. My heart rate was super fast. I was sitting down, obviously laying in the hospital bed, and my heart rate was like 112, which is, I have SVT, so my heart rate's always really high, but it's never been that bad, and my blood pressure was really high. It was like 160 over 90, and they kept giving me like IV fluids, expecting that to, magically solve the problem. And I was like, the problem is that I'm in pain, number one, and that there's something, going on. And so basically, after the second bag of IV fluid, they were like, well, you just got pleurisy, so that's what it is. Here's some steroids. Here's 2 days of 5 milligram hydrocodone. Good luck. Follow up with your primary care doctor. So a couple of days after that, I think it was the third day of my steroids, and I was still like in super bad pain. Like it was just getting out of control. So I went to the urgent care, and I saw the doctor, and he was basically kind of like, there's not really much we can do for pleurisy. Like, maybe you should go back to the ER. Like, nah, man, like I just left there. I'm tired of circling the drain of care providers and facilities. Just let's all why is it, if it gets any worse, come back? No, like it's bad now. I'm here now. Let's do something about it now. Let's not, treat this as a mild thing. And then one of the doctors in the I think it was the urgent care department was like, oh, your blood pressure is a little elevated. 160 over 90 is not a little bit elevated. Like, I'm really over doctors trying to downplay things just because they don't, know for sure what's going on or what the actual problem is. Don't downplay my symptoms. Number one, like, if I'm over here, there's a problem. So I don't know. That's what's going on now. And I think it sucks that I have to even, feel like, well, should I go back to the doctor? Should I not? I mean, go back to the ER or should I not? And I feel like that's something that a lot of us, who aren't the normal cases of, health issues or whatever have to go through. And it sucks. Just sit there and be like, oh, well, I don't want to go to the ER again because, they're only going to X, Y, and Z. It shouldn't be like that. But I don't know. So that's my dilemma now, is just trying to figure out, what to do. Should I just ride it out, and hope that I get better? Or go back to another ER for them to possibly not do anything else, other than have me sit there in pain and, keep me in a room.